I believe that, with grave concerns, that the underlying cause of the COVID-19 disease is being overlooked. This disease, I think, could be neutralized if the correct approach is taken to it, and it will no longer be a death threat of the results of the coronavirus. The coronavirus is maybe a new form of the coronavirus, but the human body hasn't changed over the years. The things that the coronavirus is stimulating in our body have not changed, and that's what we need to deal with. That's why I'm trying to get people to refocus on the approach to this disease, and we can neutralise it. My name is Jennifer Taylor. I'm an Australian scientist with over 45 years' experience in the diagnostic field of both human and veterinary medicine. As more and more diverse complications of the coronavirus infection are becoming apparent, it is time to take a closer look at the actual underlying cause of the many presentations of the COVID-19 disease in the human body. The virus itself is being investigated and researched, but the medical management of the disease process remains problematic. This video is aimed at the largest audience of scientific researchers and medical and hospital personnel possible. The coronavirus may be a novel virus, but the pathophysiology of the human body is not. It is well known and mapped. In looking for the mechanism of this disease, the one process that answers all aspects of toxicity and lethality is an overwhelming of nitrogen metabolism, resulting in the production of ammonia. I believe that all attempts to treat a COVID-19 patient should be focused on decreasing the intracellular nitrogen load, thus allowing normal cellular metabolism and utilisation of oxygen to proceed. There are no new drugs involved in this. No new research needs to be developed, and there's no money trail. Medical protocols for this approach are already well established in the emergency room for use in other diagnostic circumstances and can be used accordingly. Respiratory viruses are known from the medical literature to precipitate hyperammonemia. However, the severity of intracellular toxicity is often poorly correlated with these blood levels. The scientific literature also records the connection of respiratory viruses overstimulating the patient's immune system, called the cytokine storm, which results in an excess of nitrogen from amino acid breakdown. Very early in this pandemic, hyperammonemia was considered as an explanation for the COVID-19 disease, but was dismissed as the blood levels were not found to be elevated. However, the spike in ammonia in the blood only lasts for a period of up to 2 to 4 hours before it's dealt with by the liver and kidney and excreted. The intracellular component left behind is where the problem is. How do I know this? In this pandemic, it's the coronavirus that triggers the nitrogen overload. Animal models are often advantageous to study similar conditions in humans. In this regard, we had the opportunity to study an episode of abnormal nitrogen metabolism associated with hyperammonemia. In 2001, I was in the USA and Kentucky establishing a veterinary laboratory on a stud farm when a weather event triggered this in the horse in the late spring. Over 5,000 mares aborted in a period of a week, and I was able to measure what was occurring. The ammonia levels in the mares only stayed elevated in the blood for a period of 2 to 4 hours. However, due to poor blood perfusion, the amniotic fluid retained high levels. The instant abortions represented a dumping of that nitrogen load. Any mares that went to term pregnancy had very high levels of ammonia in the amniotic fluid, as did cord blood taken at the foal birth. We were able to measure cord blood because IDEX laboratories have a stat test that takes 8 minutes with dry chemistry that can measure ammonia on the spot. The ammonia was quickly cleared from the blood in this case, but remained trapped in the intra and extracellular fluid. The foals at birth were born gasping and unable to breathe. They had abnormal colouring of the gums and mucous membranes, were weak within coordination and showed failure to stand and nurse, exhibited general disorientation and had lactic acidosis. The clinical sign of ammonia toxicity in affected foals was very problematic for survival. Remarkably, foals treated by the veterinary professionals for ammonia toxicity shortly after birth returned to normal with a few hours. So this represented an uncomplicated response to treatment as the original insult had been removed. There is a backstory to this. In the general horse population, while mares were aborting in the following weeks, there was a reportable, notable increase in number of cases of pericarditis, laminitis, endocarditis, central nervous system dysfunction, unilateral uveitis, and cardiorespiratory problems. Also, semen examination in the stallions during this time recorded an overall decrease in the number of sperm present, plus an increased count for atypical morphology. This represented that some of the non-pregnant horses with ammonia exposure had also experienced pathological disease processes. The medical aspects of ammonia toxicity. All of these facts are referenced in the scientific literature. This is not new work, this is textbook medicine and also present in scientific articles. Ammonia toxicity, 1, causes hypoxia as it inhibits the uptake of oxygen by body cells. 2, it damages the immune system. 3, it allows invasion by opportunistic pathogens. These mares' placentas of the ones that did go to term were invaded by not one, but many different opportunistic pathogens that were in the area at the time. The ammonia contact had spoiled the integrity of the placental barrier. Ammonia toxicity 4 coagulates protein in body fluids. This is also an interesting fact, as many of the veterinarians on the ground were seeing in their ultrasounds and radiology pictures this very strange ground glass appearance, which no one could explain. However, when you look at the fact that there was ammonia present in the fluid, it was coagulated protein. This has been reported and may be the reason that the lung pictures, the radiological lung pictures, had this ground glass appearance in them because of the presence of ammonia. 5, it is associated with a cytokine storm, very well documented in the scientific literature, that the cytokine storm will cause high ammonia levels. 6, it is not often seen in babies and young children unless there are congenital disease factors, and this does follow the course of the COVID-19 disease. 7, you need efficient liver and kidney function to enable excretion. This ability is compromised in the elderly and patients with underlying medical conditions, which together represent 10% of the susceptible population. 8. Acid-base abnormalities in coronavirus-affected lungs can favour ammonia buildup. Ammonia can be present either in the cation form of NH4+, or the gaseous form of NH3. 9. It's exacerbated by dietary factors, for example, a high protein diet. 10. It causes fatigue, mental confusion, and eventual coma, as the gaseous form of ammonia can cross the blood-brain barrier. And this is why your patients arrive in casualty and they cannot tell you what their name is, because the presence of ammonia impairs cognitive ability. 11. It's associated with hyperglycemia in spite of elevated plasma insulin. This is because the nitrogen that is present blocks glycolysis, the utilisation of glucose, and so you end up with an insulin-resistant diabetes. 12. Ammonia toxicity. Accumulation in the pericardium can lead to the risk of heart damage and failure. Any patients that have heart conditions will have inflammatory changes around their pericardium. This inflammation will trap ammonia in these areas and allow it to enter the cell. It's probably the reason that anti-inflammatories do have an effect on this disease. 13. High ammonia levels are rapidly lethal if untreated. Now, treatments that should be considered are designed to decrease the nitrogen load. The treatment of hyperammonemia is well established in medicine as it is such an immediate and lethal condition. The first important consideration is that there should be no enteral or parenteral administration of protein or amino acids. These will dangerously overload the amount of nitrogen present and exacerbate the problem. Treatments that can be considered range from a simple sugar called lactulose that is used or used to be used as an anti-constipation treatment for patients in nursing homes. The side effect of this treatment is that it clears very efficiently ammonia from the gut. Very simple sugar, very simple treatment. Antibiotics aimed at reducing ammonogenic bacteria, that's the bacteria that are very efficient at breaking down protein and producing nitrogen. These are antibiotics such as neomycin and rifaximin. We found in the mares some studs had 80 to 90% foal loss. Some studs had 20%, and when I went and looked at these, they were on a product called Fast Track, which was an antibiotic that reduced these ammonogenic bacteria. IV fluids are used to re-establish hydration levels throughout the body fluid and correct the acid-base balance and adjust electrolytes, particularly calcium and potassium. LOLA, that's L-O-L-A, it stands for L-ornithine, L-aspartate, and acylcarnitine. These are the cycles that are naturally found in the cells that will funnel nitrogen off and remove it from the main metabolic pathways of the cell. It's well documented. Enhancement autophagy is the natural physiological system of ammonia detoxification by the body. We are very protected with energy systems that try and reduce nitrogen load because it's such a lethality. The interesting side effect from this is hydroxychloroquine. Hydroxychloroquine is a very good antiviral drug. It will stop the coronavirus from entering your cells. However, if you already have the COVID-19 disease where you have high levels of nitrogen in the form of ammonia, it will shut down autophagy and take away one of your main areas of cellular metabolism. So that is why it's a dangerous drug to use in those circumstances. The use of ammonia scavengers, drugs that work by increasing the excretion of ammonia through alternate pathways for the metabolism of glutamine. And once again, I refer you back to the metabolic pathways, the intracellular metabolic pathways. And the ultimate treatment is dialysis. Any clearing of ammonia from blood plasma will improve tissue perfusion gradients and will draw the nitrogen out of the cells and allow it to be excreted. This was used in the first wave in New York, where after speaking to both renal and liver experts who were very good, well versed in this nitrogen overload, they noticed that many of their patients had high urea values, urea being a nitrogen substance, and on dialysis there was a great improvement in their COVID-19 patients. This was reported in the New York Times. Conclusion. The coronavirus is triggering a disruption of nitrogen metabolism, which produces high ammonia levels throughout all body fluids. This, in inflammatory conditions, is not necessarily reflected by hyperammonemia, which is a measure that only represents the blood plasma content. 2 years ago, I suggested that the ammonia breath test may be of use in detecting this disease, and it should be explored further. Just the same as the police can use a breath test to detect alcohol, as you can't go around smelling ammonia on the breath of patients, it would be possible to have a breath test when your patients arrive at the hospital. You could give them an ammonia breath test. If they have ammonia on their breath, you put them in the wards. If they haven't got ammonia on the breath, you send them home to self-isolate. This breath test has been employed and developed in Singapore, and you cannot get on a Singapore airline at the moment without undergoing a breath test. I'm not sure of the details of it, but there is a breath test that is involved with with passengers getting on a plane. Ammonia toxicity explains all of the different presentations for the COVID-19 disease progression. It's the reason that the medical management and treatments need to focus on ammonia dispersal, i.e. decreasing levels of nitrogen that have built up, as this condition is very quickly lethal if left untreated. I have written a review paper. It is a review of the known textbook and medical literature. It has 22 references in it, all of which with a click can be pulled up on a computer. They've all got Medscape references that back up exactly the facts that I have talked about today. So all aspects are actually online. I want to encourage everybody to read that paper and to refocus on this disease, because if we efficiently manage this disease and take away the threat of this disease, then we hopefully will get out of lockdowns. I'd also like to mention the Emirates professor Thomas Schwerzik, who wrote this paper with me. He is a very well-versed and well-written professor at the University of Kentucky. Please read the paper.